Hi everyone. In this lecture, I will give information about kidney function and kidney function test. The kidneys are main organ that regulates body hemostasis. Kidney function tests are key parameters, especially understanding the condition of kidneys and monitoring the kidney problems. Kidney function test will give us information in understanding the status of kidney and main organs. Why do we need a kidney function test? Because we need to test kidney using kidney function test to identify renal dysfunction, to diagnose renal disease, to reveal the principal site of pathology, to assess degree of functional damage, to monitoring disease progress, and to monitor response to treatments. And for this reason, it's very clear to test kidney function can be a good tool in our hand to understand general metabolic processes and general problems in our body. When you look at a kidney function test, as I told you, the main task of kidneys is to maintain hemostasis in the body. And before starting to give information about kidney function test, I will give a little bit information about kidney function. And our kidneys are responsible for water metabolism, electrolyte and acid-base balance, excretion of metabolic products, and we know very well that also kidney has an important role as endocrine role in our body. And monitoring of kidney functions is important to follow other organ functions because some kidney function test is not related to directly kidneys, but can be give detailed information, general problems in the body. And in case of clinical impairment of kidney functions, nephrons may have lost their functions at a rate close to 30 to 50%. It is so important thing for physicians because we have to follow its kidney functions because patients attend or came to you for some health problems, kidney problems. It's maybe its reference may have lost 30 or 25 or 50% of function. This is so important things for us. And when blood enters the glomerular capillaries at about 70 millimeter pressure, then this capillaries restrict only very large molecules, protects this kind of molecules, and the resulting filtrate is blood plasma, and the large molecules, the filtrate plasma, we say ultrafiltrate, include water, ions, urea, glucose, some minerals, vitamins, and some drugs, and so on. The tubular cells after that then actively or passively reabsorb 99% of filtrate these components. And for this reason, this kidney has two main roles. First is filtration, another one is reabsorption, and can be a control or maintaining hemostasis in the body. When you look at water metabolism, one of the basic tasks of kidney is to regulate water metabolism. It is responsibility of the kidney to filter blood and reabsorb the ultrafiltrate and regenerate the urine content. When we look at ultrafiltrate, approximately 1% of ultrafiltrate can be turned to urine. And urine concentration depend on person, but normally we accepted that it is 1.5 liter or 2 liter each day. But sometimes there is some problems, metabolic problems and renal function problems. The urine concentration go down approximately 400 milliliter and up to 25 liters. This is each day. This is depend on problem. And products of proteins and nucleic acid lead to solid loading, and mainly urea, sodium chloride, potassium, creatinine, and ammonium sulfate solids are found in urine. On the other hand, some substances such as the glucose and protein, which are the major needs, as you know, especially energy and protein synthesis of the body, are not included in the urine except for illness or pathologic conditions. And urine, which is effective in maintaining the balance of the body, is usually it is acidic form. Of course, it is depend on food eaten and drank during the day. This pH value can vary between 4.7 and 8.4. Also, it will depend on different factors. And we know that very well. The first problem of the kidney, it is ability to concentrate ability. And this is so important things because also it is so important issue for hematostasis. And final products such as uric acid, urea, creatinine lead to solid overload, and we need water for the excretion of lactate or beta hydroxybutyric. And glucose causes the most solid loading. And when you look at function of renal function of water metabolism, in water metabolism, we have some ability for normal renal function, such as glomerular filtration rate and renal plasma flow velocity must be normal, and kidney cells must be normal condition. In this case, hemostasis is going to very well. Otherwise, we will meet different type of problems. And ADH, antidiuretic hormone, also named as a vasopressin, as mainly enhance the reabsorption of water. It is responsible for water metabolism and homeostasis of water. And central diabetes insipidus is caused by vasopressin deficiency and problems, as we have a big problem with a polyuria. In this case, water amount as water secretion increased to from 5 or 10 liter, maybe much more than this. It is depend on problem synthesis or deficiency in ADH hormone. Also, osmolarity is defined as the amount of dissolved particles in the 1 liter of solution, and shown as osmol per liter. And is also glucose and sodium and chlor and other electrolyte are responsible for osmolarity. And urinary density is 1.003 and 1.025. Also, this urinary density, it depends on the solids dissolved in the urine. It is a density measurement, easy to measure, and it gives general information to us. In case where serum osmolarity decrease, ADH secretion is suppressed and serum osmolarity is brought to normal by increasing urine output. Another function of renal uh, tissue and organs is electrolyte acid-base balance. It is another important role for uh, renal functions. Acid-base hemostasis and pH regulation are critical for both normal physiology and cell metabolism and function. In acid-base balance, the kidney is responsible for two major activities. First is the reabsorption of filtrate bicarbonate. Another one is excretion of the fixed acid. Especially proximal tubules reabsorb of chloride, sodium, and potassium, especially bicarbonate, calcium, and phosphate. This is so important role for proximal tubules. And distal tubules also has a role for electrolyte and acid balance, especially secretion of protons, and potassium. Also reabsorb sodium bicarbonate. It uptakes these bicarbonate sodium molecules. And we know that very well that kidney and lungs play a central role in maintaining acid-base balance in the body. Another function of excretion of metabolic products is it is another important role for kidney or kidney metabolism. The end products of protein, lipid metabolism, and nucleotide metabolism are carbon and nitrogen-based compounds. Kidneys play a key role in removing these end products. Kidney do not allow the loss of glucose, amino acid, and shaped elements of the blood and protect this kind of molecules. And sometimes it takes back some of the molecules, such as urea, bicarbonate, and uric acid. And the third one is allowed to excretion molecule like creatinine molecules. This kind of molecules didn't take inside of blood, must be excretion or to urine. And special diet for kidney patients depends on the structural properties of the final products. It is another important task for us. And we know very well that kidney has so important endocrine role. Also, we can accept that it can be an endocrine organ or organs. As when you look at this role, the first one is vasopressin or antidiuretic hormones is responsible for water retention. It's so important regulation role for kidneys, and in this case, the blood pressure can be increased. Also, aldosterone renin-angiotensin system, especially aldosterone, is responsible for sodium metabolism and sodium retention and water retention and control. Also, renin-angiotensin system also responsible for vasoconstriction and synthesis or aldosterone, vasopressin or release vasopressin and aldosterone hormones. It is very regular. It has very important regulative role. Also, atrial natriuretic factor ANT, NAF, has an important role in vasodilatation and increased glomerular filtration rate, GFR. Another important molecules is synthesis in kidneys, erythropoietin. Erythropoietin is responsible for synthesis of red blood cell, and red blood cell amount is decreased in the blood. In this case, we can meet some big problems such as hypoxia and decrease oxygen concentration and pressure, partial pressure of oxygen. And in this case, is kidney must be synthesis erythropoietin and increased red blood cell concentration and amount, and after that it is possible to transfer oxygen from transfer to central organs. It is so important role. Also, we can understand why we will meet some anemia during kidney disease. Another important role, important endocrine role, activation of vitamin D. Vitamin D, active form of these vitamins, responsible for calcium metabolism regulation, especially calcium reabsorption. It is so when you look at all these roles, endocrine roles in kidneys, it's very clear to understand why we called or named kidney as an endocrine organ. Also, kidneys has a different roles, such as breakdown of some molecules such as insulin, glucagon, and aldosterone. Also, it is another regulative way in metabolic processes. How we can monitoring kidney function? We have some tools inside our hand. It is so some of them so important for understanding kidney functions. When we'll now in this lecture we look at is importance of glomerular filtration rate as a protein metabolism, urea, uric acid, and osmolarity, and electrolyte concentration. All of them generally are easy to measure these tests. We can achieve this very easy, and all of them are cheap testing in the lab. But it does describe the location of pathology generally and etiology, but we can understand some problems, some kidney functions problems. It is a good tool. Also, another important role or advantage, alert kidney disease or systemic disease. First is glomerular filtration rate. Also, we say clearance. Clearance is defined as the quantity of blood cleared of a substance per unit time, and depends on the plasma concentration of the substance and the excretion rate of the kidney, which reflects GFR and renal plasma flow. Also, we have some molecules for calculate glomerular filtration rate. The first is inulin molecules called inulin clearance. The gold standard of direct GFR measurement, but it has some disadvantage, such as it is exogenous molecules. It's not suitable for daily application as it requires complex and difficult laboratory methods. Also, for this reason, we need some endogenous molecules. These molecules, it will not be metabolized in the body, must be filtered from glomeruli, and no reabsorption from tubulus. When you look at molecules, we have this kind of molecules, this ability, and it is creatinine. And creatine clearance is measure of the glomerular filtration rate. It is a good tool for understanding glomerular filtration rate. Urine and serum creatine levels are measured, and creatine clearance rate is calculated. And for this reason, when you look at a creatinine molecule, as creatinine molecule can be accepted as last products because from arginine and glycine amino acid produced. Also, we need as adenosine methionine molecules and produce creatine. As creatine molecules later turn to phosphocreatine molecule. Phosphocreatine molecule is one of the most important energetic molecules in our body, especially in the muscle, for using energy sources. After that, this molecule turns to creatinine in muscle. And creatinine shows the kidney's ability to concentrate. And this concentration depends on age and gender and some different problems. When you look at man, is a creatinine serum concentration between approximately 1 and 1.5, and in the woman 0.7 and 1.3 milligram each per deciliter. It is plasma creatinine concentration depends on some factors, as plasma creatinine concentration decreases during pregnancy, starvation, wasting disease, corticosteroid using, low protein intake, dialysis. And we can see some problems in increased plasma creatinine concentration, bleeding, and high protein diet, and dehydration, especially in renal failure, urinary stasis, shock, surgery, and diabetic nephropathy. And we can see it's creatinine. As a result, mean creatinine generation is higher in men than in women, in younger than in older individuals, and in blacks than in whites. This leads to difference in serum creatinine concentration according to or depend on age, gender, and race. You have to keep it in your mind when you calculate creatinine levels and concentration. Also, we have some formula, and we use this formula. We calculate creatinine clearance, and for this reason, we need creatinine expressed in the urine in 24 hours. Also, we need creatinine concentration or levels in sera as milligram per deciliter. Also, we have to calculate urine constant volume of urine in milliliter per unit. Also, it is better to collect urine during 21 hours. Also, there's a lot of formulas for calculating creatinine clearance concentration. But we have to know this is depend on age, gender, and so on. And typically, creatinine clearance for healthy adults is 80 between 80 and 120 milliliter each per minute. And when you look at serum creatinine concentration and the genius creatinine clearance, normal man and normal woman, range, as I told you, is man change man and woman. In the serum creatinine levels, especially 1.0, 1.5, 1.6, and creatinine clearance a little bit higher in man, higher than woman. But we can practically keep it this creatinine concentration as 1 milliliter and like that, 1 milligram 100 milliliter. And also creatinine clearance, you can accept that approximately 100 milliliter per minute. as it is easy to recognize or remember. 1 milligram 100 per 100 milligram, and creatine clearance is approximately 100 milliliter in a minute. It's easy. And when you look at creatine clearance levels, some problems and conditions increase creatine clearance values, such as pregnancy, exercise, high cardiac output syndrome. Also, sometimes as creatine clearance uh, concentration can be decreased. Also, in this case, is a very sensitive indicator of decreased glomerular filtration rate. And first is disease of kidney with impaired renal function and congestive heart failure and cirrhosis, shock, dehydration, and bladder obstruction can be a result to decrease creatine clearance in creatine clearance level or concentration. When we look at glomerular filtration category and glomerular filtration rate, and we can describe kidney function. And also, we can look at this glomerular filtration categories like G1, G2, G3AB, G4, and G5. And glomerular filtration, you can see is normal condition, approximately 1 milliliter minute is normal adults, and we can describe normal or normal conditions. But this filtration rate can be go down step by step and reach to 15, and we understand that especially between 15 and 23 or 30, we can understand that there is a very serious problem in kidneys function. Also, this filtration rate decreases 15. This we can describe as kidney failure. It's so important tool for us to understanding kidney function. Second one is urea. Also, sometimes we say blood urine nitrogen levels. Blood is urea is also accepted that some last product of protein or amino acid metabolism, especially in human and mammals. Almost 70% of the nitrogen excreted in the form of urea. Urea is very important for excretion of nitrogen molecule, because we accepted that it is so dangerous product. Ammonia is a toxic product of nitrogen metabolism that should be removed from our body. It's so important things for health. The urea cycle converts excess ammonia into urea in the mitochondria of liver cells. Also, cytosol and mitochondria matrix can be take role in all metabolic processes. The urea forms then enter the bloodstream, is filtrated by the kidneys, and is ultimately excreted in the urine. As we know very well, filtrated urea can be reabsorbed by tubulus back to blood. When you look at blood urea nitrogen, you know that this blood urea molecule is consists of oxygen, carbon, and 2 nitrogen molecules. Also, molecular weight of urea is 60 grams, but each molecule contains nitrogen 28 grams. This is called blood urea nitrogen. It's another description of urea concentration in blood. Serum concentration of 28 milligram deciliter of urea is in urea nitrogen is equivalent to 60 milligram deciliter per deciliter of urea. And when you look at urea or blood urea nitrogen test, also we check it blood urea nitrogen is equal to 50% of urea. Blood urea levels is sensitive but not specific indicator for renal dysfunction because its levels affected by dietary protein diet, other non-renal causes such as liver disease and blood pressure may rise its level. Also, another important issue is urea levels can give some information about liver disease and other problems. Its level is elevated in the last stage of renal failure after 50% of renal function is lost. This is so important sign of physician because we have to check and urea or BUN concentration. We understand that its level increase high level. We understand that renal failure after 50% of renal function is lost. Therefore, other more accurate test is creatinine, which is specific for kidney, is performed. And creatinine and creatinine clearance test is more suitable than blood urea, nitrogen urea, but other side, on the other hand, we will check the blood urea nitrogen urea concentration in blood. We can understand it give a little bit information about kidney function and other organs pathologies and problems. When you look at BUN creatinine ratio, another good issue to understanding kidney problems, check two molecules together, look at BUN and creatinine concentration ratio, and normally is BUN creatinine ratio approximately is 10 to 1, but we accept that is approximately 20. Sometimes we accept that often other level 15, but some resources indicated that this ratio as 20. Also, we can accept that between 15 and 20. BUN creatinine ratio is raised. This is suggestive of renal azotemia. In this case, there is poor renal perfusion like hypovolemia or hypertension. It is related to renal problems. Also, sometimes post-renal azotemia cause BUN creatinine ratio is rise, such as congestive heart failure, urinary tract obstruction, and gastrointestinal bleeding and trauma. And BUN creatinine ratio is decreased sometimes, such as dietary protein deficiency and severe liver disease. It's a better way. We have to calculate creatinine and creatinine clearance and BUN, and so we'll look at BUN creatinine ratio for understanding kidney function. Another tools in our hand for understanding kidney functions, protein levels. I would say proteinuria. Proteinuria is the most specific in identifying kidney disease because under normal condition, urine does not contain protein. We generally said that, but it's not necessarily correct. But sometimes trace amount of protein may be present at the level of 30 milligram per day in the urine. But in the practically we accepted that urine does not contain protein. A condition where the amount of protein in the urine is 30, between 30 to 300 milligram per day, is defined as microalbumin. Microalbuminuria may be first sign of glomerular pathology. As protein urea it can be most important tool for understanding kidney function. Maybe it will be first. When you look at proteinuria reason, which problems can be caused to proteinuria, and the first one is the glomerular proteinuria. Glomerular proteinuria called albuminuria, and diffuse kidney disease such as diabetes caused albuminuria. Some immune complex disease like nephrotic syndrome and pyelonephritis. Nephrotic syndrome is described by a large amount of proteinuria. Protein concentration in the urine increase 3.5 gram per day. This is a huge amount of protein in the urine, and also hypoalbuminemia and hyperlipidemia and edema are another sign of nephrotic syndrome. Other one, glomerulonephritis, which sudden onset of microscopic hematuria, proteinuria, oliguria, azotemia, edema, and hypertension. But when you look at it is depend on infection. If we accept that is after infection disease, then cause this kind of problems, acute glomerulonephritis. There is so important sign. First is hematuria, second one is proteinuria. Another proteinuria described as a tubular proteinuria with the amino acid urease. For example, lysine is arginocysteine amino acid can be released to urine, but it's not normal condition because the amino acid must be reabsorbed by tubules. But we can see lysine arginocysteine in some problems, genetic problems related to tubulus function. Another one is burn and pancreatitis. Also, nephrotic syndrome and nephrotic drugs can be caused tubular proteinuria. Third one is overproduction proteinuria. It's very there's very specific unique protein called Ben-Jones proteinuria. If you deduct in urine Ben-Jones proteinuria in case we accept that it can be related to multiple myeloma. It can be diagnosis for multiple myeloma. And third one, last one is post-renal proteinuria. It is dependent on the bladder disease, inflammation, stone, and tumor. And when you check protein, urea, and glomerular filtration rate together, it can be a good explanation for understanding problems, nephron or kidney problems. When you look at is normal glomerular filtration rate, as I told you, you can accept that approximately 100, and in this case we accepted that is protein urea lower than 20 milligram day, but glomerular filtration rate go down such as 15, and in this case if proteinuria concentration can be increased 1 gram or 2 grams higher than 300 milligram per day. It's a very important sign for us. In this table you can see it's green color indicated that low risk, as yellow is a moderate increased risk renal problems for renal problems, and orange color indicated that high risk, and also red color is so important for kidney functions and kidney problems. Also said that it is very high risk for renal functions. Maybe it's a good way we check protein albuminuria and glomerular filtration rate together to understanding kidney function. Another molecule sometimes we can use kidney function, but it is not specific molecules for understanding problems of kidneys. Uric acid. Uric acid is a pure metabolism end product, especially adenine and guanine degradative way is in the metabolic processes. We can produce uric acid, and increased uric acid level in blood cause gut disease. And in this case, normally uric acid level between 4.5 and 7.5 milligram per deciliter day, but in this case these levels increase and cause very serious problems such as pain and inflammation. And when you look at reason of hyperacemia, the essential first is overproduction. Overproduction means purine denosynthesis. If it is increased, end of this stage, a degradative way must be increased, and in the body, in the cells, produce amount of uricemia, uric acid, we say hyperuricemia. Also, nucleic acid turnover increased hyperuricemia. Some enzyme defects, such as Leishman syndrome, this problem is key enzyme of purine salvage pathway, hypoxanthine guanine phosphotransferase activity. In this case, in this syndrome, we can recognize as a hyperuricemia or some another problems because it's syndrome. And PRP synthase activity also caused increased hyperuricemia, kidney failure, lead toxicity, and some diuretics cause hyperuricemia. Also, if depressed as uric acid synthesis is blocked, we call it hyperuricemia. It is generally depend on xanthine oxidase enzyme genetic problems. Also, the second one is hepatocellular disease and radiopaque materials cause hyperuricemia. In this case, uric acid levels in blood decrease. It goes to 2 milligram deciliter per day. As you understand, the uric acid molecule, it is not specific for kidney disease, but it can be give some information, some detailed information about different problems. Also, we can use this molecule for understanding kidney problems. And last one is very practical way to understand kidney function. We say urine test strip. Also, a standard urine test strip may compromise up to different chemical reagents. Is so important. Also, routine testing of the urine with multi-parameter strip is the first step in the diagnosis of wide range of disease. After that, you can match some problems or see some problems. This urine test strip. Also, you can check another tests such as creatinine clearance and proteinuria and so on. The analysis includes testing for the presence of proteins, glucose, ketones, hemoglobin, bilirubin, and urobilinogen, acetone, nitrite, and leukocyte, and pH, and specific gravity of kidney function. It is first step. It is very easy and cheap test. You can use this unit test strip for understanding problems in first stage. After that, you can use another tool in your lab. End of this explanation, I would like to complete my lecture. Thank you for attention. Bye bye.